Okay, so the next thing that I'm going to do is a thorough skin analysis on my client who has had an eye and lip cleanse, a superficial deep cleanse, and we've toned and blotted to prepare for our skin analysis today, okay? So I am just letting my client know that I am wiping over the mag lamp with Surgical Spirit. I already did it this morning, but this is to ensure our clients that we are complying with health and safety and we are hygienic at all times. So I'm just wiping underneath and over the glass and around the mag lamp. These can become quite dusty, so it's really important to continue to clean them. I'm now just going to buff my mag lamp off with some tissue just to make sure we get rid of any streaks from the product that I just applied. Then going to sanitize my hands because I've just touched Surgical Spirit and I'm about to touch my client's skin just with a sanitizer gel. And I am going to cover my client's eyes with damp half moons. We use damp so they don't fall off, and we use half moons because if we use a full cotton pad disc, we won't be able to see the whole of the client's cheek. So it's just important that you use half ones instead. Okay, I'm going to switch my mag lamp on now. Just explain to my client that they will feel a bright light shining over them. Is that okay for you, client?
Yes.
Fabulous, okay. So try and start your skin analysis from the chest area and do all of those things that we suggested. So touching your client's skin, does it feel soft? What's the texture like? Is it rough, soft? When you touch your client's skin, does it bounce back quite quickly, meaning that they could have good elasticity in their skin, which my client does? Also, do your circulation test. When you touch the client's skin, does the colour bounce back quite quickly? If it doesn't, it means that they have poor circulation. If it does, it means they have good circulation. Be sure to work on all areas for this. So my client's skin, it feels, besides the area where my client has shaved this morning, everywhere else it does feel fairly smooth. Circulation is good, elasticity is good. Sometimes you generally find that in a male client's skin, they do tend to age a lot slower than females. So sometimes you'll find that they have their skin feels a lot more smoother for longer. Having a look at my client's chest area, I can see a few marks of pigmentation. Coming up the neck, I just feel where my client has had a shave. Be sure to inform your male clients about shaving in the correct way to prevent anything like folliculitis or tinea barbae, which is any infections of the hair follicle and your male client's beard. Don't see that much congestion on the skin. When I look on the cheeks, I'm seeing a lot more now, okay? So I'm seeing some marks of some dark pigmentation on there, some what we call hyperpigmentation. Pore size, it's a mixture of being refined and some medium-sized pores. Stepping onto the nose, I can see a few black dots which would indicate signs of comedones, which are known as blackheads. The nose itself does appear a little bit shiny, but it feels a little bit rough to touch, which means our client could probably do with a good exfoliation. Just looking around the cheeks further on, I can see more around this side, some little white spots that could be a form of melia. Now these could be in advanced facials be extracted out just to help remove any build-up of any dirt in the area. Just one little papula I can see at the side of my client's face. Some underlying ones are coming onto the cheek as well. Stepping onto the forehead, I can see My client has a few expression lines appearing through. These may have started as dehydration lines and then continued on to expression lines. We need to be careful that these don't become deep set wrinkles. Feels fairly smooth to touch, but also a slight drag, which may indicate some signs of dehydration. So I'm just going to do a test where, as you can see, any little lines popping up could indicate some dehydration on the skin. So from this, I've found out that my client has some pigmentation marks, some congestion in regards to comedones and melia. They definitely, in the forehead, it feels a lot dehydrated when I do my dehydration tests. Beard itself feels between smooth and rough to touch. So I'm going to ask my client some questions about their lifestyle and about their concerns, so I can adapt the actual treatment to suit the needs of my client. Okay, I'm just going to turn off my mag lamp first. Thank you. Okay, so what are your main concerns for your facial treatment today?
Making the skin look smooth and nice.
Yeah, smooth.
Nice. Get rid of the amelia spots, hopefully.
Yeah.
Suppose having a look at these expression lines and also looking at the blackheads and I suppose with the nose, with the dryness.
Lovely. Okay, so from here today, I can identify that your skin is what we call a bit of a dehydrated skin type with some signs of congestion. What I would recommend that we do today is definitely exfoliate your skin, especially on the nose area, so we can tackle the signs of congestion in that area. We're going to do a lovely facial massage for you today, and that'll help to moisturise your skin and just put the hydration back into your skin to treat any areas of dehydration. And we'll also work that with the mask that we choose. So I think I'll use a moisturising mask around the forehead and around signs of the chin and the neck area and chest. Around your cheeks and your nose, I think I'll use something for a little bit more of a combination skin to tackle any signs of congestion. Does that sound okay for you today?
Yes, sounds good.
Okay, what I would recommend that you do is make sure you drink plenty of water just to boost your hydration to avoid any of these dehydration lines. Be sure to use a moisturiser that's got something like vitamin E in it, so it's constantly moisturising your skin. Try and exfoliate once to twice a week and use a mask where appropriate. I would make sure that if you are in the sunlight, if you are going out in the sun coming up with the summer months, that you do wear an SPF just to protect your skin. You can continue to drink plenty of water, keep yourself nice and hydrated. Try and book in for a facial between 3 to 4 weeks if you can as well, okay?
Okay.
Does that sound okay for you?
Sounds fine.
Thank you.